Hi guys, welcome to the Kelvin TV. My name is Nesche. Today we are going to learn on checking of vital signs, that is temperature, pulse, respiration, and then BP. So here is my patient, Mr. Amon AJ Kelvin. So guys, stay with us. So before checking the vital signs, you have to explain the procedure and then also establish rapport to your patient. Nti ano na mebedin kan de aye. Mr. Kelvin, good morning. Na anope de omo ye de.
Bachoboko.
Ade na me asepa. Empacho feminist. Anope se ne de bia ye na da. E ba be check vitals. E ka se vital signs a. E ba be check se ne ho hye ene ho university. Afen so se ne emoja esi edi afisa ne ewo nipadua no me ba me de ade e be cheche won sakaka enye hu bia je se ebemi a kakra de bet me se o se won so be de wo be bo amena metima de a check ya man ba jo me won kwan se e ko family man. So after explain the procedure and then also establish rapport with the patient, then you have to send your tray. This is a tray procedure, not a tray. This is a tray procedure. So these are the equipment that we need. And nyama you be here, you be check it. Patient, the vitals, your vital sign sheet, and on our bed chat also. After so we alcohol sanitizer, and now the be personal hygiene. What the be wrap on, sir. After so your receiver ewa hase your cotton wool your dry one and your swap and so ye de ewo ho afen so your BP apparatus no and your thermometer. But first of all many can procedure ni once I am for breast watch ama may improvise breast watch afen so first check no obedi can check vital signs no instrument no say a function very well and sakra na what their back patient no baby a patient na yede e won nti bedin kan de assess ani many nyina yede. So the next step is my back patient na nchen baby a oda no I don't know whether the patient is feeling comfortable or not. Nti I'll ask the patient say be will feel comfortable or not say will feel comfortable. Mr. J, Empacho, many of my the very vital. Empacho, once we proceed here when you person who says, "Oh, better one answer, oh, person, oh, sorry, class." Better. Indeed, so you sit down here and answer me elevated bed and okay, that's it. So the patient said we should elevate the bed because patient no say you sit down or who say any day M1. And I feel so as a nurse, that's the importance of elevating the bed. Come on. Until the next step, and I said you use your alcohol sanitizer for hand hygiene. Then I will also do the second check of the instrument. Let's say me thermometer as well as say a back. Until we are thermometer, we be clean it from the bulb to the stem. Until after say when we know. This is the button from the bulb to the stem. Yeah, part of me the you ever saw motor and nona me check his name. And now see it. One said, and now buy and never saw kakra. Until I no pay SME day, a check it a man. Until before I said, my clinic thermometer na wi no. When you cotton. This one there, a swap cotton, and now the bed, a big cleaning patient and armpit and a man. Until my clean every. So at the same time, we'll check it temperature. Now we'll check it the pulse on so until routine, that is TPR, temperature pulse respiration. ABI 1 minute, 1 minute. So within 3 minutes, as I know I check it, I mommy and say I'm a boss in temperature pulse respiration. But before then, over check it temperature and pulse no. We are not about to check respiration. We'll check it temperature and pulse no. That is in 1 minute. Now, or share or breast watching, and so now we'll check it 1 minute now. As one, it's a swan. No way. Now I'm about to check respiration and so. So guys, after say my check pulse no every no. Into thermometer and the still na better than ampete. At the same time, now was a check respiration because patient be or be suspicious like send you wusi share no obe wusi akwasa ade. So we thermometer na at the same time now we check it respiration also. Yeah, now we say check it breast watch for 1 minute. Now we check it. But in all, no, my catch was a 3 minutes. Temperature and pulse no respiration in a 3 minutes. Maybe TPR no. To we are over paper thermometer no from the stem to the bulb. Once you shall send a bulb to stem, to obey if stem to bulb. More cleaning a camera. We are now the share dealing. Then after that, I'm coming to check the BP. Until before I say we check BP, so we apply personal hygiene so kakra using the alcohol sanitizer. Actually, Mr. Kelvin, I better do one. Maybe I check this and a wakuman is able. Next and a muja is here for sunny. You move with the better tones up a baby on Kaka. As I was saying, and said I now give you a useful fine. Until before so by checking, you have to also check if the BP apparatus it function. A year you may and sana what they are say patient and answer. Then now I have some from maybe I need a engine one. So guys, when we are checking the BP, the instrument should be at the patient chest level. And as I said, a better you see. Maybe a patient need to one and maybe I'm a bone one. Now what the BP apparatus now at all come. Watch it now we check. That's all. Okay, guys, so I'm done with checking the patient's vital signs. First of all, you have to check the temperature, pulse, respiration. After you are done, then you check the BP. So maybe then many patients in the bed they didn't come kakra. Make sure because everyone will buy now I was rock kakra. So someone may ask, say, Adentina may check the patient BP the children and sabin. Ideally, we all know that yaya anatomy da. Check patient the BP because of the heart is located on the left side of the chest. The checking on and sabin. So I'm done with the vitals. Then as making sure the patient will feel comfortable in bed. And time now by so you're checking the vitals. Not I was wrong. As my patient right now I'm checking all the vitals above them kakra and I say be a stone and baby and Mr. J. Kelvin and said and now buy you're checking the BP vitals temperature and pulse. I said no buy now why is it kakra? She said above them kakra. Near Mr. One's over Coson why they were for window come. Said the bear be also better, a bear come. You see the Americans be come. Then after you are done, you have to also make sure the patient is feeling comfortable in bed. So guys, when you are done checking all the vitals, then you have to wash your hands. Until we are vital signs chatting. You're chatting patient bedside. And you're only generally chatting. After I said, what was she on say real? What continental nursing station one? No one will tell no idea, no chatting also. So guys, then you document. So guys, thank you for watching the Kelvin TV. Bye bye.